Well, thanks everybody for joining us. I kind of started this off with how's it going, because I wanted to start off by seeing if anybody wanted to share anything before we, see, I don't know what I'm doing with my, there we go. I'm not going to touch my mouse anymore. But we wanted to start off to see if anybody wanted to give any updates, because I know a lot of you do and participate in other coalition groups. Some of you are members of the Medicaid Managed Care organization that's working on trying to create a better Medicaid system. So I just wanted to start off and see if anybody wanted to have their, give any updates or talk about something in particular before we go run right into our recap. We have a number of different things we wanted to go over that's kind of going on since we last met in July. And then we have some questions we have of you about the things that you're going to care about.
At this point, Amy, I don't see any hands raised, so maybe people can add some stuff in as we get through the topics there. But I'll give one last chance here. Does anybody need to unmute or want to communicate?
We'll ask again. I started it off that way because I started it when I did the PowerPoint presentation and didn't think I had a lot to report on. And then when we started working on it, Bill and I kept coming up with other things that we wanted to talk about. So yeah, I'll just launch right into it, and then we'll ask again a little bit later about how things are going and what's happening out there. But the first thing we wanted to talk about, I hope you all got a chance to see that the Iowa Medicaid is doing provider and member meetings monthly. This is a new thing they just launched this month. They're going to try to do it on the fourth Thursday. The provider meeting will be 4 to 5 o'clock in the evening. And then the member meeting is at 6 o'clock for an hour, 6 to 7. And it would be on the fourth Thursday of every month. I think you'll probably have a change in November and December on that for the holidays, because it'll probably hit the holiday season. But that's their thoughts. There is a link. I put it here, but we can copy that into the chat later if you are not able to find where that is. We also have it in InfoNet and on our website, which is over in the corner there. If you go to the most current newsletter at that infonetiowa.org, you'll find the link to where you can sign up for the member meetings. You can sign up for each one, or you can sign up for all of them. So they currently have 2 already planned. I can't see my notes, so I can't tell you. It's September 28th. Is that right, Bill? I gotta get my calendar. Whatever the fourth Thursday of September is. Yes.
The 30th. The 30th.
The 30th. Yes. So September 30th, and then again October 28th will be the next 2. So I had a chance to be on the provider one as well as most of the member one, and there was a lot of talk about transportation. A lot of people were able to bring up concerns that they're having with Medicaid, and it's pretty much all of the Medicaid staff is on that call to help answer questions or to help find a way to start fixing a problem. So that's how they're going to identify issues. They also want to have it be an opportunity for people to talk about what they can do better and new ideas. And so it's both problem solving as well as an opportunity to talk about new approaches and new ways of doing things. So I'd encourage everybody to be a part of that if they are a provider or a member, to sign up for those.
Amy, really quick, the provider part is from 4 to 5, and the member meeting is from 5 to 6, and it's actually the 23rd. So we slipped in another, I think there's 5 Thursdays in September, so the 4th Thursday, but it is the 23rd. And there's a link there in your chat. So, and I would just add to Amy's comments is I've read through a number of people who have attended and kind of shared their notes from the meeting. It seems like they do cover a lot of topics. They're provided an opportunity for a lot of feedback, and we're carefully watching the subjects that are being covered there, because it looks like they're providing an opportunity for people to influence how services are provided. So
Thanks, Bill. Yeah, did I say 6? I meant 4 to 5 and 5 to 6. Yes. Also, last we talked, we thought we would be having a special session in August, and that has changed to October. So there will be a special session of the legislature in October sometime to deal with redistricting. That's redrawing the political maps. So congressional districts will change. State legislative districts, so House and Senate, will both change. And we talked a lot about the redistricting process before. We had issue of InfoNet earlier this summer that kind of went through Iowa's model redistricting laws. There will be 3 public hearings on the first map that is presented to legislators, and those are scheduled later in September on the week of the 20th, September 20th. We have those in InfoNet's calendar at infonetiowa.org. We also have that listed in our last newsletter, and how you can find out where to find the links to get that. I do not believe you have to sign up for that, but the links aren't available yet for what that will be. Normally, we do in-person meetings around the state. They have to be in 3 different geographical areas. This year, they're doing them all Zoom. So I think that gives people more options. They don't have to physically go somewhere. And if the one in your region doesn't meet your calendar needs, then you can pick one of the other ones without having to travel. So that will be an opportunity for you to see what that map looks like. And then they will take feedback on it. I don't think they got a lot of feedback before because the maps are done by nonpartisan staff. So it's usually not a political process. But the legislature will be voting on those in October. There are a couple of elections coming up. We wanted to remind people of that the new election laws are in place now. There's a special election in Ankeny. It's kind of the northern part of Ankeny and some of the rural areas around it on September 14th, Tuesday, September 14th. And that's to replace State Representative John Landon, who died of cancer last month. And there are 2 people running. The Democrat is Andrea Phillips, who ran against John Landon before. And then the Republican is Mike Bushlow, who many of you may recognize that name. He was the Department of Management Director, and he was Governor Branstad's chief of staff, and the person that really spearheaded the whole managed care transition. So some of you will recognize his name. He's a CPA and a lawyer. And so he's been working in private practice and then just went to the Department of Management recently. There's also, while this isn't as big of a, you don't hear as much about the elections in November in these odd years, but there is a city and school board election coming up on November 2nd. So city council, your mayor might be on the ballot, and then your school boards. And I think this is the first school board election that is now in November. They used to have a special one in September for them, but they've aligned them with the city elections so that people can turn out for both of those. So that's November 2nd. I put the link in here for voter information. I think what's important to note is that there are a couple changes that were made to elections that may impact people with disabilities if you vote from home or vote by mail. The first thing is, if you go to this link, it'll tell you whether you are an active or on the active voter roll. There were some changes made that allow the Secretary of State to remove people from the active voter roll if you haven't voted in recent elections. So it's just a good idea to make sure you check whether you're registered to vote and if you're registered at the current address, your current address, and to encourage others to do that check first. Better to know about it before Election Day than get there and realize you're not on the list. So I think that's important to do. And then secondly, if you are voting by mail, the ballot has to be received by the end of Election Day. So you're really putting a lot of trust in the mail if you do it. You know, like I wouldn't do it the day before because you're not going to be guaranteed that that's going to get received by that time. So those voting by mail want to turn that ballot around fast, like vote it and send it in, or have some or deliver it down to the auditor's office in person.
Amy, I would just offer up that if anybody's struggling or they're trying to connect to vote, they can certainly contact me. I'll put my information in the contact information so that if someone wants assistance, if you know of anybody who wants assistance, you can please share my information to do that. We are updating our training and working with the Secretary of State to try to make sure that people that are, that have disabilities are aware of the changes and how that might affect them, but also how to connect and access their vote. So there are some changes, and I think that if they're aware of what they are, that the targets are narrowed or maybe changed a little bit, but it doesn't mean that people can't participate. They certainly can, and we want to make sure they know how to do that.
I'm not going to go through the whole list of staff and candidates that are changing, but there are a number of legislators who are running for higher office, Congress, governor. And so I did include those in our last issue of InfoNet that just came out earlier this week. So I would encourage you to go check out the newsletter and see who we know has announced they're not running again, but once we see those new maps, we'll have a lot more to add to that list because people will make decisions based on what their new map looks like of whether they're going to run for office. But there are a couple of people that are challenging congressional candidates and Senator Grassley. And so that list we'll just keep updating and putting on our website. Bill had some federal updates he wanted to go over from a recent call he made, and they have a cool cartoon there too. So
yeah, so we just yesterday got this information, Brooke and I did. So I just wanted to share it with you. I don't have a lot of information. I'm going to participate in a phone call today at 1 o'clock where we'll get a little more information, but just wanted to point a few things out. There is a voting rights advancement bill that's been passed from the U.S. House of Representatives, and it's in recognition or in the name of John Lewis, who had passed away earlier this year. And it's really about looking at the title 7 ways new voting laws can affect people with disabilities for background. And so I think for that one, I think that's just something to pay attention to. If it has passed the House, then they're going to be looking at it from the Senate. It might be something that you want to be familiar with. And so it's addressing a lot of the things that we try to bring to the legislators' attention when the voting laws were being looked at. One is that restricting the number of days for absentee voting sometimes affects people with disabilities, limiting the number of places where people can drop off their vote and who can provide assistance does that. So this would put some safeguards in places. And so that's something to pay attention to. There's also a reconciliation bill and HCBS funding sent to the House committee. And from our advocate who's in DC, she says that HCBS funding needs a strong advocacy push to maintain. Right now, it's listed in the bill at $400 billion, and to be able to keep that, because now as the bill narrows, there will have to be some decisions made. So we want to pay attention to that. And then the last one, I'll go to the bottom one there. It talks about that just recently, the U.S. Department of Education is opening an investigation into 5 states kind of regards to the mask mandates. And I'm sure people are aware of that one. There's not a lot more information I have on any of those three, except for that those are bills that are being considered right now at the federal level that we'll continue to kind of monitor, but send information out. The one that I would probably lift up, the one that I think that probably needs the most attention from our area is the HCBS advocacy. And so again, that 400 billion, contacting your Congress and to ask him to include that HCBS services and support the Better Care Jobs Act is an important thing to kind of be looking at. And so kind of give some information there. And there's a reflection of one that had occurred in Wisconsin. So those are just some federal updates. Again, that one infrastructure bill that went through does need a lot of support, and it's a great opportunity. You could go right to this is my 30-second commercial on our Take Action Center. You can go there, find out who your senator or legislator is on the national level, and you can email them directly from our Infinite site. And we'd love to have you contact them, let them know that there's tough decisions to be made with that bill, but that you're in support of that full funding of the HCBS services in the reconciliation bill. So yeah, those are my updates. Not a lot of deeper detail than I have on that yet, but wanted to pass that on.
Unmute myself. I put this in the chat that we will get this fact sheet up on the website after the meeting, and I will create an action item on our action center to on this, so it'll be really easy for you to take action if this is something important to you. That should probably be done within the hour after this call. We just got this yesterday, so otherwise we would have had it ready to go for you this morning. I did also want to note that Jen Wolf posted that she has a face-to-face with Ashley Hinson on the 24th. So I don't know, should people contact you, Jen, if they want to join you at that?
Yes, and I'll put my email in the chat.
Awesome. Thank you. That's great. And Representative Hinton is the congressperson representing the Cedar Rapids, that district over there. Is that, I don't remember district number, 2nd district? Somewhere here in the Cedar Rapids area. Or 1st district.
Sorry, I don't know that either.
You had that in there already. Yes, thank you. Just moving forward, a couple other updates. I think we mentioned this before, but the American Rescue Plan Act, or ARPA, sometimes people call it ARA, depends whether you want to add the plan in there, or ARP. It's the DHS submitted their spending plan on how they're going to spend the state dollars coming in for out of that. And I did put this link. Let me see if I can copy my link, and probably not going to let me do that. I can, for some reason it's not showing me the link. I will put the link in here, but there you can link to the spending plan. It's 15 pages long. It's not that bad, but it does detail how the state's going to enhance training and support for HCBS providers, help improve access, particularly in some of those rural areas, as well as in those crisis response areas. Expand training and support. And of course, one of the things that the DD Council has always been in support of is the expansion of the direct care worker registry, and helping families get access to people that can provide various services, home and community-based services. And so that is included in the DHS plan. There are deadlines in there. There's some discussion about the realignment of the departments. Right now, public health and Department of Human Services are in a, they're calling it a realignment. It is also a merger. of those two departments, the concept being that there would be an overall umbrella agency that would work on aging, behavioral health, public health, maternal child health, and Medicaid and Human Services. It's a model that the current DHS director, Kelly Garcia, is familiar with. They have that in Texas, where there is more alignment amongst all of the departments. The legislature has been very interested in this because they're interested in the opportunities to eliminate what they consider duplication in staffing. Don't think anybody in the departments would say they're understaffed or overstaffed. They would say they're understaffed. There is a website where you can go to watch the realignment discussion. They will be having public hearings on that. I will also put that link in the chat. I put it in my notes and then I can't get to my notes while I have this up, but I will make sure I get that into the chat for you. The regions are in current discussions with the department on the service expectations and how they will use the new 100% state funded system that went into place on July 1. I think the big thing that you should need to know is that one, they need to make sure that the legislature commits to continued funding this next year of the regions. I think we'll know more once we see how many regions apply for the risk pool funds, or it's not risk pool, how much the extra dollars when they don't have enough funds to get through the year. So like the Polk counties and of the state that don't have enough out of their per capita to get through the year without cuts. So I think you'll see more of that as you come closer to January. A number of state agencies are working on workforce. So you might see workforce work groups popping up around. We'll try to keep track of those and make sure we put them on our social media feeds when they do come up. I know that there was a meeting in Davenport last week about workforce in general, but also specifically nursing, direct care support staff, all of the health and human services areas of workforce have been coming up as well, not just manufacturing and other types of workforce issues. So workforce is going to be a big topic this year. Rural health is going to be a big topic. So Bill, I don't know if you have any other updates we wanted to add in.
Yeah, just two things that are kind of more of a commercial. We will have our Make Your Mark conference on September 15th and 16th. I know a number of people are registered and looking forward to having people there. We are offering a virtual option and that registration is still open. Would love to have people join us virtually. You can sign up and there are different sessions there. I think there's a lot of great information and we have some even presenters that are listening in today. So I'm really looking forward to spending that time learning to become a better advocate, but also providing opportunities for people to connect with their legislators. The other thing I wanted to point out is the other night we had a learning session on the ABLE accounts and really excited about the information that was provided there. That video should be coming out soon and you'll be able to find that on our website. And it's about an hour, a little longer than an hour. We scheduled an hour and I think we went an hour and 15 because there were so many great questions that were asked there. And the ABLE account is something that the Department of Treasury kind of keeps us updated of what changes are going on with the laws there and how they affect people and really have seen an uptick in the number of people who are using that as a tool to put money away and put it aside without any penalty. So that's a great thing. Those are my two updates.
Yep, and Brooke has the link to the Make Your Mark conference registration in the chat there. So hopefully everybody's signed up. So before we go on to like looking ahead at 2022. Does anybody else have, do you guys have any questions or want to talk about something else or have any other updates that you want to talk about? Things you might have been involved in and that we didn't cover? Going back to my how's it going that I started off with.
Amy, Jeff Lauer here. Quick question.
Hey, Jeff.
I'm not sure if this is germane. It's a comment about stay reviews for the HCBS population in general. Last year, to my understanding, DHS suspended many of the annual reviews for individuals on the home and community-based waivers because of the pandemic. And they basically used status quo for people to keep services. So it's been a year, and now there's a wave of initiative for level of care reanalysis on people's stays. I can't speak to other waivers, but I can speak in the brain injury waiver. The apparent capacity and ability of assessors to assess people with cognitive disabilities has changed considerably. There's more reliance on the inter-RAI, which for those of us in the brain injury community well know that even the authors of the inter-RAI declared that it's not valid or reliable for brain injury. And so we've seen a significant number of clients being noticed that their services are being cut. And so we're in the midst of both individual advocacy, supporting appeals, and trying to gather information to feed back to DHS on the kind of, it's hard to say exactly what it is. It wouldn't be surprising. I think we can blame the pandemic to some degree for turnover and a lack of continuity of being able to assess people with cognitive disabilities as opposed to essential activities of daily living. So just wanted to throw that out there as a heads up.
Thanks, Jeff. You know, I just started hearing about that, so I'm really glad you brought that up.
Sure.
Let me know if you hear more from them about.
We're still gathering information, and it's gotten past the point of, 3 clients. We try to wait till there's 3 points we can draw a straight line, and as opposed to just some outliers. But again, it's not that surprising. It's a difficult population to do 2 independent assessments for, and then try to merge those when you're under pressure to go and kind of recapture assessments for 100% of the clientele out there. So I'm sure there's also some heat on the contracted assessors.
I think it's really interesting. I also talked to a legislator last week, and they were surprised that MCOs are, I know this isn't just, this is about the reassessment, but they were surprised that there was still a shortening of approvals happening, or, they're requiring more frequent determinations of continued, eligibility for things because, the state could not drop anybody off of Medicaid during the pandemic. They couldn't remove anybody. So people might have private insurance that's picking up their costs. However, they're still paying the per member per month to the MCO. So the MCO is getting the money, even though they're not liable for paying out for the cost of the services.
Yikes.
So legislators were saying MCOs should have a lot of money right now to not have to be denying services. So I just want you to keep that in your mind, is they are actually getting paid for people they're not having to provide services to because of that federal law that says you can't during the pandemic that you can't drop off people
Right.
on Medicaid.
Well, there are national algorithms that are clear that they use. Centene, for example, as people may or may not know, has been found fraudulent in a couple of states and had to pay back more than $140 million in Medicaid profits because of simply cutting people off of services. And so, again, I'm not suggesting anything except that there's a pattern of MCO automation that when the button gets pushed to get vigilant on reducing costs sooner for being able to manage longer term savings, this is the kind of squishing out of individuals that happens, even with, in these cases, really kind, long-standing case managers. But these are the ones, again, that work for the MCOs, and they're just kind of shrugging and saying, this is happening across the state, and it's the state's, it's what we have to do. And, again, advocates would say, well, it's what you're being told to do. And so, and this is what we have to do. So it's that push-pull of trying to balance the pendulum swinging from not being able to cut anybody to opening that door again and having the, again, what I assume to be and understand to be the MCO actuarial algorithms kick in.
Thank you. Yeah, Jen, Scott,
Amy, we did,
go ahead.
oh, I was gonna say, we had a hand raised by Jen Wolf as well there, I think.
The FSDIS and health and disability waivers are also getting their hours cut.
Right.
So it's across the board,
Yeah.
which is terrible.
Yeah.
Yeah, and it's interesting because you know that I think it was mentioned on the member call last week that DHS is looking at all the waivers to try to make them more equitable. So there's not differences between waivers. Well, doing that at this to improve access at the same time that you're having these restricted access issues with the MCOs. So it's kind of, they're going at opposite ends there.
Mm.
I don't know the timeline on that waiver review, but I know that they've contracted with somebody to do it. So I guess my goal is there's two ways to equalize waivers. You can either bring everybody down or you can bring everybody up, so I think the challenge will be to watch how they equalize, who loses, who wins.
Exactly.
I think we always talked about it. You can have it be the floor or the ceiling, and you want to make sure that you're working up, not down, to equalize.
We sure want that. Thank you.
Any other things people want to share before we ask you what you're thinking about for next year? Don't be shy. Everybody's a friendly group here.
This is Jen Wolf again. I'm going to put in the chat, we're hosting an an Iowa-based emergency and disaster awareness and disability town hall on Thursday, the 16th, and everyone is welcome to participate.
Awesome. Thank you, Jen. I think I shared that on our Facebook. If I didn't, I'll make sure I do that again, or do that. You guys are doing great stuff out there. Brooke or Bill, did I miss anything that you wanted to, before we ask about next year?
I don't think so, Amy.
I think it's a good time to talk about emergencies, Jen, because what's going on in New York and New Orleans right now? Seems to be a disaster month.
Yikes.
Okay, well, we wanted to, while we have you, we actually have a survey out right now. So if you're a member, please feel free to share our survey link. It's on our website, right on the front page. There's a box right below the main picture, and it says take our survey. It's really short, but we thought while we had everybody here, it's completely anonymous. I'm not going to know how you all voted, but we have a number of things that we wanted to do a kind of a quick poll on. So I have one on students and one on faculty, but I think we had to break it up. So I don't know, Emily, do you want to share that first quick poll, and we'll see if you guys want to vote on those things. I think pick 3, I said. I don't know if it'll let you pick 3, but you can just go ahead and, I know it'll take a while to read through all of them. If you pick other, we'll let you bring up others. Nobody's voted.
We're working on it.
I know.
It's hard to pick between those.
It is. I think I'm on the one that we have posted on the website. It says select up to 5, but I couldn't make it only be 5. So literally, if you want to select them all when you get onto our main page, you can. But I do encourage people to share that survey. That really helps Bill and I and Brooke be able to know what issues to pay attention to at the Capitol. What things to focus on in talking about. We were just saying, we were watching over 100 bills, and mainly because every time we don't watch something, somebody asks us why we aren't tracking that. So it really helps us when we ask people, what issues are important to them, for us to kind of gauge that.
I don't know if it gives you the option on here to say what other things you'd like us to look at, but you could just enter those in the chat too if we're missing something here that we don't have, because Lord knows there's probably a lot else that could be addressed too. These are just what we came up with.
If you selected other, just put it in the chat and we will keep track of those. What we'll do is we'll add these to the rest of the survey so that we can kind of see what people are thinking about. I know there's some overlap in a lot of those, but and it doesn't mean if we don't have people picking it, like if not everybody says require adult changing stations in all public facilities, we're going to still follow that, because we know we have some advocates that are working really hard on that. So, well, I think 10 of you have voted. That's probably those of us that are on that are talking that won't. But it looks like Medicaid waiver waiting lists are. Do I hit share results? Is that what I do? I don't know. But it looks like Medicaid waiver waiting lists, provider rates are on the top tier. Some voting rights and support for direct care worker reimbursement, funding regional services. Those look like the top vote getters right now. And ending managed care in Iowa. I wish I could say that's an option, but I think we're going to be. I was just on a call with the Department on Aging and the area agencies on aging, and they were on a call with CMS that's apparently CMS is wanting to review whether managed care in states actually saves money and provides better access. So that'll be interesting if they actually do that. So I have to ask a technical question of Emily. Emily, when I click this off, we'll have the polling results saved, right?
Yep, I believe that'll save, in Zoom for us.
Okay, good. Because now, guess what? We're going to ask you about federal issues. So again, I just want to remind you that if you have anything that we were missing on the state level, Jen just added something, go ahead and throw that in the chat. So now the next one is ideas for Congress. So I'm sure that Jen's going to tell Ashley Hinson something. So what would you want Congress to work on? Again, those are things that we just saw on there, or on the list of issues that some national groups are working on. I know a big one that they're working on is that not allowing the waiver waiting list, really making home and community-based services a requirement. So again, if you have an other, just throw that into the chat too. I know you guys are all probably working on things individually too. This list is a little bit smaller, so you could read through it a lot faster. Not surprisingly, the way HCBS waiver and funding and helping with employment are some top. What did I do? I saw my future stuff. Give it. It's about how many we had last time too, isn't it? So, any last thoughts? I'll get it up here to 2 minutes. It's 1 minute and 45. You got 15 seconds left if you didn't answer. Oh yeah, Jen posted about accessible housing options too. Yes. I know that there's still a work group working on that too. All right. Yep. So about 3/4 of you are on the HCBS waiver waiting list, not allowing them anymore, and so that they would be a mandated service, and then more funding. So those remain the top priorities. So
Amy, one thing.
Oh, go ahead.
I was just going to add, this kind of goes both to the state and federal, and it kind of connects to some of the things we reviewed there. But Brooke and I last week, or maybe 2 weeks ago, attended the Harkin Institute had a presentation on employment and kind of a summit on employment. And they actually had people from all over the United States come in and present on some really forward ways of thinking of and engagement and bringing people into employment opportunities and making employment accessible and equal to everybody. And then Senator Harkin was there, and he actually, I mean, I just was really inspired by his continued passion and desire to support people in Iowa with disabilities, but also across the United States. And he kind of talked about in his opening conversation the things that he's trying to still accomplish over the next, I don't know how many years, in regards to both employment, housing, funding structure. And he was very aware of a lot of the priorities that you guys are lifting up as your top ones. And but more specifically to the employment piece, there are a lot of agencies that were there. And when I say agencies, I mean, I guess companies would be a better word, that, you know, there was a gentleman who spoke who 10 years ago had not employed anybody with a disability, and now has made some bold decisions that can move towards that and increase the number of people, and actually has people focused on that in his HR department, and really has improved the services. And there was there was companies in Iowa as well that in some of the initiatives they were having, and just really inspired by the advocacy. And I walked out of there feeling like it's really great to spend time with a group of people that see the value and the importance of the advocacy work that we're all doing together. And instead of maybe fighting against laws or restrictions or rules that kind of limit and that we have to fight against. And I know those are real, and they certainly are limiting. But there was a lot of when you spend some time, especially I think if you've heard Senator Harkin speak, he really has a way of making it sound like we're where we should be, and really presents a very strong vision for that. But it did reflect, his comments reflected a lot of what your guys' top priorities were. So that was good to see that connection.
Thanks, Bill. Well, I'll, in the interest of time, move on. So of course it's not summer anymore, it's fall. So we had earlier in July encouraged everybody to make sure they advocate over the summer. It's just so much easier to talk to your elected officials, whatever level they're at, in the summer and fall, because they're back home, they have more time. I know that, there's a lot of farmers that are still in the legislature, so I know that they will be soon, or if not now, out in their fields working, but we've had a lot of luck meeting legislators for coffee, and you get a lot better feedback right now. So I would encourage you guys that do have issues you want to talk about with your legislators to do it now rather than waiting. Particularly since we were just joking earlier about, oh my gosh, we only have 3 months for Christmas and they're already starting to hawk their Christmas stuff this year. And so it'll be session before we know it. There'll be snow on the ground before we know it. So take advantage of this opportunity that you have now. I know for a fact that the legislators are now setting their priorities for next session. It'll be a fast session. And so they're going to have their stuff lined up before they even get up to the Capitol. So now's a great time. Just wanted to throw that plug in there again. And also, redistricting has a really funny effect on advocacy. When they see their new maps, they're suddenly going to get really interested in paying attention to people that aren't in their district, but will be their voters the next cycle. So there's a really unique opportunity if you end up in a district with a legislator that's new to you. There's a really good opportunity for you to connect with them, because they're going to be trying to figure out ways to make those connections with their new voters. So I think that's a really good opportunity once we see those new maps, and hopefully we'll have some discussion about that in future Capitol chats. Couple other questions. Sorry to survey you a lot, but we want to know how we can help you. We're working on our website and resources. We're going to look at doing some more how-to videos, look at other things that we can do to help you. So we have a couple different questions just to get an idea of what things might be helpful in your advocacy. Maybe it's none, but if there are some other things that we can do. We do want to do regular Capitol chats. I hope they're helpful, but if there's other ideas you have for us, just throw them in. I know a lot of you do some great Facebook Live events that we've been able to participate in, and we try not to duplicate what you're already doing. So give you guys a little bit more time. Yay, people like Capitol chats. You don't have to do that just because we're on one.
I can only fill out the survey so many times.
Well, and I'm of a certain demographic that may not be as tuned in as some of the new opportunities we have for advocacy. So those of you that are younger.
Amy, just a quick commercial for this next session. Each Monday, Amy and I are going to do somewhere between a 1 to 3 minute video that kind of talks about what happened the week before up at the Capitol. And so we're putting those videos out online, definitely on our websites, but we'll send them in social media through Twitter and Facebook, and making that connection. But it will be a brief summary of anything that occurred during the week before, and kind of a summary of our Infonet brief email. So you'll get that as well, along with the Capitol chat. So
yeah, Bill and I talked about, we're going to meet up at the Capitol and do I don't know, maybe it'll be a YouTube, maybe it'll be a Facebook Live. We'll work out the details, but we thought it would, I know if you're like me, you get so many emails, it's hard to read through them all in detail. So we just want to kind of recap the highlights of what's going on at the Capitol and opportunities for that week. And we figured Monday, when everybody's kind of getting ready for the week, that would be a good time. So yeah, I hate being on video, so maybe it'll be Bill more. All right, and I think we have another, so it does look like Capitol chats for 90%, and then followed up by videos and action alerts, kind of good spread, more chances to meet with elected officials. It's probably a good time to put in a plug for your town hall grants that you do, Bill.
Yeah, we have on the website, we have just exactly that, a grant for town hall meetings where if you apply for that, we can supply some financial support and some encouragement and maybe even some training to help a group that you're trying to bring together and advocate. And so you can read a little more about it, but it's really what your cause is, as long as it's related to kind of connecting people with disabilities, but it's just our way to kind of help you guys move forward and share your message and connect with people. So
thanks, Bill. And just a note that for kind of what we're thinking about moving forward into 2022, one of the things, we're going to have fewer mailed copies of InfoNet, but more frequent, hopefully a little bit shorter Infonets. We're going to do them weekly during session. And so, but the people that get them by mail, it'll be less frequent. They'll be a little bit bulkier, but we'll only do those 4 times a year. It's very, very expensive to mail those out. And so we really have found that more people are accessing things online. We don't intend to make it so that you have to have that. That's kind of why we're doing the Bill and Amy show on Monday mornings, because we want to make it more accessible to people that may not have time to read through that or don't want to read through all of that detail. And so, so we are going to look at doing an editorial board with InfoNet, just to get some more perspectives on what we should be putting into our materials. And so if you are interested in that, Bill, do you want to throw in your email or my email into the chat? Feel free to contact either Bill or I. Mine's pretty easy, Amy at IA Lobby, LOBBY. Bill's is a little bit more DHS-y. So, but let us know, and don't be offended if we don't choose you. We're going to try to make sure we have a broad spectrum of folks to work on that, just to help kind of guide content. There's really no other, it's advisory, so you're not going to be like volunteering to do like writing unless you want to. We'd love to have anybody provide a guest article in InfoNet or put out information that you have. So those of you that do that stuff, always feel free to send me something or send a suggestion to put in. We'd love to have that. We also want to highlight advocate stories more. We did a little bit of that last year, but people are so darn shy. I mean, I don't know why anybody who doesn't want to share how successful their advocacy was, but people are a little more humble and don't want to brag about themselves. And well, we want to brag, because I think when you see that somebody else has been successful, even if it's making small progress toward a goal, it makes it more likely that people feel like they might be able to do the same. So you're really helping other people feel more comfortable when you share your story. So if you have ideas of people out there that we should, highlight, let me know, and we'll go after it and write the story. We just want to make sure that we focus and highlight some of those advocates. And maybe we do it in a story, and maybe we do it as a video. We're also going to be putting together some short kind of how-to videos. I know there's a lot out there already. So we'll just pick various topics and put them on our website. We will have them available through our YouTube channel as well. But pretty much everything we'll make sure we connect on our website. We do have a section of the website specifically for videos that where we post our Capital Chat. We post those every time too there. So you can always watch past Capital Chats if you want to catch up on those or if you miss one. Hopefully we'll have a schedule out for the Capital Chats pretty soon for the remainder of this year and then into 2022, at least through getting us through session and toward the primary in June. So we should have 6 months of them scheduled out here pretty soon. Maybe it's a good time to just pause and ask, are Fridays at 11 pretty good for people in general, or even though we kind of changed it this time because of the holiday? Probably as good as anything.
We got some yeses. I know Brooke and I've gotten feedback that people go and they share the video or they watch the video after, which, as Amy and I don't like to be be recorded. Not that we're worried about what we're saying, just that we have to listen to our voices and which you guys know because you have to. But we're glad that people are sharing them and they're finding them useful. And and we get questions from people who haven't attended that listen to it the day before. So as much as you can share it, that'd be helpful too as well.
I think that's all I had, Bill. If anybody else has anything.
Yeah, I would just end with, what Amy was saying there at the end, really thankful for everybody's participation. We are looking for, we don't want to have 100 people only for the fact that we want to have a good kind of a small working group to make sure that what we're putting out is the right content. And so we're kind of looking for, so if you have an advocate that you really feel like could provide some insight into how we can do the Infonet and the Capital Chats better, we would like to have that. Or I really like, Amy kind of comes up with all these great ideas a little bit sometimes on the fly. And I love the idea of a guest editorial or a advocate highlight. People don't like to pat themselves on the back, but we just completed this August a Youth Leadership Academy. And there's a lot of youth across the state of Iowa who are ready to advocate, ready to have a loud voice of their own individual needs, but that of their community. But they also really admire the work that so many of you do. And they were able to kind of make connections on things they've attended, whether it's Make Your Mark and hearing different breakout sessions, or whether it's even kind of connecting to different media posts that have been out there. So it's good to share the work that you're doing, because there are people listening, not only people who need to hear it so they make the right decisions, but also people who are looking to be inspired to share their voice as well. So happy Labor Day weekend, right?
That was a great wrap there, Bill.
Yeah.
And Amy, we did have the final poll question, if you wanted to pop it up really quick, just about how people prefer to get the information, if we wanted to just take a quick vote on that.
I forgot we had that one too. One last thing. You're all like me. I don't want to get mail anymore.
It's a little disconcerting. I mean, I know that that's how people don't want it. We're ready to make that full transition to go paperless, right?
Yeah, you guys are a pretty tech savvy group here. Well, it looks like emails and social media are pretty easy, something online. We are going to look at options for texting for people that want to opt in. So if you happen to get at some point requests if you want to do text, we wouldn't overdo that, but I think that's an option for people too. And of course, then people can opt out of that if it's too much. So, well, thank you, everyone. I hope everybody has a great Labor Day weekend. We're going to Kansas City for Irish dance.
Exciting.
They have a festival there, so we'll be wearing our masks because it's Missouri. Thanks, everybody.
Thank you, everyone. Have a great weekend.
Bye.